to. We're going to start with statins. Statins are so cool. They're going to be like, you know what? I'm just going to go ahead and block this HMG coenzyme A reductase. You don't have to know nitty-gritty detail, but this is the enzyme that makes cholesterol. So they lower the cholesterol this way because they just go and they just block the enzyme. Now, they also, on the liver membrane, they actually put more LDL receptors. So if liver's like, oh my gosh, I need cholesterol to make bile, they're like, okay, don't be dramatic, honey. We can just take it from the blood, okay? So the only problem with statins is you're going to ask our patients if they have any muscle pain or if they're having cholestatic urine. That means they're having rhabdomyolysis. So rhabdomyolysis is a condition where the statins, they go ahead and indirectly block the enzyme that provides the energy to the muscles. Now muscles are like, we're not getting ATP. We're just going to break down. That's it. And you're going to see myoglobin in your blood. That myoglobin is going to go ahead and clog your kidneys. Ugh, and boom, you got acute kidney damage. So we always keep an eye if there's any muscle pain because we want to make sure that they are not having rhabdo. Rhabdomyolysis means muscle breakdown. Okay, it's not the muscle breakdown that's actually threatening. The main threatening is your myoglobin because your myoglobin is going to clog the kidneys. Creatine phosphokinases is the enzyme. So if you go for the testing and you have elevated CPK, that means you're having muscle breakdown. But there's going to be other symptoms as well, like black, tarry, urine. Now, we always take the cholesterol lowering drugs at night because at night your body makes cholesterol, except lovastatin because it's short acting. Okay, rest all of the drugs are taken at night. Now our bile acid sequestrants, the easiest way to remember is that it is a story of three cold sisters, or you can say it is a story of three cold sisters. That's what I say. So this sister is cholecystipol. Okay, and the other sister is cholecystvalum, and this sister is cholestyramine. Okay, so it's a story of three cold sisters. Cool thing about bile acid sequestrant is that they lower the cholesterol. However, there is a big but. But they increase your triglycerides. Yeah. But the cool thing about them is that there's no systemic absorption. They act locally. So they're only going to go ahead and act locally in your intestines. Okay? Because it's going to act locally in your intestines. So you should take it an hour before or 4 hours after a meal. Okay? Next is our niacin. Niacin is so cool that it's going to decrease your triglycerides. It is going to decrease your cholesterol. It is going to decrease your LDLs. It's going to increase your HDL. So this is such a cool guy, right? Niacin is also called vitamin B3. We don't use it because of the side effects that is flush. You're going to get flush and itchy. Look at this guy. Liver toxic, uric acid is going to increase. As from my previous video, if uric acid is increasing, you can get gout. Your sugar is going to be high, so you must have ASA before you take niacin. Now, ASA is acetyl salicylic acid, just simply aspirin, nothing else. Now, fibrates are like, you know what? Fork this up. Ugh. Okay, so fibrates going to decrease your triglycerides. They're going to start breaking down triglycerides. Fibrates are like, you know what? Fork this up. Doom, doom, doom. I'm going to break the triglycerides. Good. So it's only going to decrease your VLDLs because it's only going to break triglycerides. So the side effects, you can either go TEGLO. I like T-GLO. So T-GLO means you're going to have triglycerides are lower. That's what it does. Gallbladder stones. That's a side effect. Liver toxic. That's a side effect. O is that oral anticoagulant interaction. And W is the oral anticoagulant that it causes interaction with. That is warfarin. So if you take warfarin and then you take fibrates, the dosage of warfarin increases. Your body reacts more to warfarin. So that's why we never take fibrates with anticoagulants. Azacitidine, like, you know what, enough. So it is going to block the absorption of cholesterol from your jejunum. So remember, azacitidine is like enough. It's going to block the cholesterol absorption in jejunum. So it is going to lower your LDLs. Okay. However, with azacitidine, there are some side effects that we should know. That's sore throat, myalgia, diarrhea, nasopharyngitis infections. Orlistat is just a fat blocker. It's like, you know what? I'm just going to block the lipase production. No lipase. There's nobody who can just break the fat down. Fat's not broken down. There's going to be no absorption. Boom. But you're also going to pee or poo-poo your fat-soluble vitamins. That is your A, D, E, and K. Okay, so that is all for the cholesterol medication. I'm just going to lower it a bit in case you guys want to take a picture. And that's all you guys need to know about cholesterol-lowering drugs.